Dr. Brad Conder here. During this week of shutdown for our company and for a lot of others, and people are there just trying to adjust to life at home and getting back to different things they haven't done before, I kind of just wanted to spend this week to really give out some free information, things that people forget, things you can kind of implement on a daily basis. And today is I want to go over the top 3 to 4 tips on self-care people can do when they have acute injuries or injuries in general that oftentimes they don't want to do or they forget to do, that are so important that you can help yourself so you don't feel like that this issue you're having, back pain, neck pain, is kind of overtaking your life. So one of the first things that I get, and this is a very common question that I'll get from people, what should I use, ice or heat? So if you're doing something throughout the day, you bend over, you reach out to get something from your shoulder hurts, your back hurts from bending over, you're sitting all day trying to do your new computer job at home, and you start getting this sharp shooting pain. One of the first things people forget to do is how to self-treat. And my first suggestion is ice. It's a very simple treatment, something people forget. A lot of times people don't want to do it because they just don't like ice. A couple things about ice. So you do want to kind of, this is my own personal ice pack. I don't always like to do it either because it's cold. I mean, it's not comfortable. So, but it's very important because ice is, a lot of people forget, ice is a natural anti-inflammatory. So a lot of acute conditions, there's a lot of inflammation going on as far as your joints, your muscles, your tissues, they're inflamed, and that's causing pain. So ice is a natural anti-inflammatory. It's very local. It goes right down to the spot, so that way you don't necessarily have to take a lot of pills to kind of help this out as far as ibuprofen, Aleve. Doesn't mean those things aren't still useful in certain cases, but ice is the first go-to for this. If you really do hate ice, like really badly, but you still feel like it would help you, say if you got a shoulder problem, a back problem is really localized, another tip is you can use an ice massage. So literally grab a piece of ice with a towel or have somebody do it for you, and just rub it in that spot for like 3 or 4 minutes. It'll go numb. That way you don't get the full effect of ice and chill your whole body, but you'll still get the inflammation control because it goes a couple inches deep and it's very localized. And the last thing about ice is you want to actually do this 2 or 3 times a day when these things come up. You don't want to just do it once and assume it's done. You want to keep on using it to kind of help it out. Now, another tip as far as ice goes, I'll tell people you can follow up with heat right away. Heat's pretty superficial, or you can use it at the same time. A lot of times I'll stick ice pack right in the bottom of my low back, and then you can put a heat pack in your upper back. That way you kind of counteract some of that feeling. So ice is the first tip as far as self-help that you can do right now. Another thing that people don't realize is important, when you're doing something that causes pain, you need to really kind of mentally start to understand what causes it. A lot of times people come into me, I don't know what I did to cause my pain. I just woke up one morning and had back pain. I just woke up one morning and had neck pain. There usually is something that's causing it, or at least an activity you know that makes it worse. If you know that activity that makes it worse, it makes it a lot easier to try to, when you talk to someone like me that's a physical therapist, it makes it a lot easier for us to give you recommendations on what to do to try to counteract what you're doing in your life that causes that problem. So the second thing is, try to make sure to take a mental note of what makes your problem worse, and so that way you can work on the things that make you feel good. And speaking to that, a lot of times people will know something that feels good. I have people that have back pain, they're like, well, if I get up and walk, it feels better. Well, my suggestion is do that more. Don't necessarily go out and walk a marathon, but if you're sitting all day at a computer and your back hurts, but it feels good to get up, set yourself a timer. Get yourself a Post-it note. I'm going to get up every hour and a half. I'm going to walk for 5 minutes, or I'm at least going to go walk for 20 minutes at lunchtime. These things are important. They're habits that you need to work on, but they're hard to do, but do the best you can. And then lastly, take advantage of your healthcare providers. Obviously, this is kind of self-promoting a little bit, but you know, I give out a ton of free information, and a lot of times people just don't need me. That's okay. I know that people are going to need me from time to time, but I'm willing to give this information to anybody that needs it, whether they need my business right now or not. So please take advantage of people like myself that are out there giving free advice, offering free sessions just to help you answer questions that you need to get answered, and you're frustrated with looking at Google or asking your neighbor that thinks they had the same thing. You know, talk to your physical therapist, talk to your doctor, call them, leave them messages. You're not bothering your medical professionals by calling. Now, right now it's a little heavy as far as like phone calls and telehealth, but don't give up. Leave messages. This is a good opportunity to learn how to educate yourself more with healthcare, and learn how to kind of interact with your healthcare providers better. We need this. We need the public to kind of push how healthcare providers interact with the patients. It's not one of those things where you shouldn't feel like you can't call your doctor or your physical therapist at any time. Push them on it. Just like you would just any other product out there. If you're buying a car and something's wrong, you're not going to just let that go. Same thing with your body. If you call your doctor's office and they're like, well, we'll get back to you when you can, they don't get back to you in a day or two, call them again. You're not going to bother them. And if you do bother them, then maybe there's something else we need to look into. But make sure to take advantage of your resources. Call your pharmacist. Call your physical therapist. Call these people and start to learn how to interact with your healthcare providers more. This is something that's going to be extremely important in the future, not just during this time of COVID-19. So hopefully this is some good information. Share this with anybody that you need as far as simple things to take care of themselves while they're stuck in their home right now. And stay safe and healthy.